Stones are usually diagnosed with the clinical history, so if the history is very suggestive of ureteric colic, then we can often establish a diagnosis from the history alone. But of course, imaging is the really optimum way of diagnosing stone disease. The traditional form of imaging is a plain X-ray and a renal ultrasound, but increasingly we're now using computer tomography or CT scan for picking up stone disease. CT scan is associated with a low radiation dose, but is really the investigation of choice now to establish the characterization and the size of stones. The majority of stones that we detect are what are known as ureteric stones, which are on the way, the stones that are moving from the kidney to the bladder. 90% of these will pass spontaneously and are usually managed with what we call supportive measures. So we provide pain relief and encourage lots of fluids during this period, and most stones will pass spontaneously. So the majority of stones don't necessarily need treatment. Those stones that do need treatment are those that, the stones that are too large to move spontaneously, or are providing the patient with unremitting pain and they need relief from that, or if there's evidence of superadded infection, or what we call a precious stone in a precious kidney, which would be a patient who suffers from a single kidney and needs that stone treating to prevent any deterioration in renal function. Some patients are susceptible to what we call recurrent stone formation. The majority of people aren't actually, but of course it is said that between 30 to 50% of the population will experience a second episode of stone disease within 5 years. Those are the quoted figures, but in fact I'm not entirely sure. My experience suggests that it is as common as that. In those patients that we investigate and find no underlying cause, the so-called idiopathic stone former, if they adjust their lifestyle sufficiently by modulating their diet and increasing their fluids, I think the recurrence rate is actually much lower than that. I'm often asked what are the lifestyle changes that one can adopt to reduce the risk of suffering from further stones. The best advice I can offer anybody is the regular production of beautiful dilute urine. And what I mean by that is urine the colour of at least champagne compared to, say, Lucozade. This requires a regular intake in fluid, clearly to drive that, what we call diuresis, the regular production of dilute urine. I'm often asked what's the volume of water to drink, and in fact that's irrelevant from my point of view. What matters is the regular production of urine, and that can be monitored by the colour of the urine and the frequency at which people use the toilet. If I have a stone former who uses the toilet 2 or 3 times a day, they're simply not drinking enough, and I can tell that from the frequency. So we're after the regular production of dilute urine, and that is by far the best, most sensible approach one can do to reduce the risk. As far as dietary manipulation is concerned, there's good evidence that reducing salt intake will reduce the risk of stones in certain patients, and we recommend that patients can cook with salt but not add it on the table. And then for those patients suffering from calcium oxalate stones, there is good evidence that reducing the oxalate intake to a significant degree may modify their stone risk. You may be thinking that actually one should reduce calcium intake given the fact that most stones are made of calcium, but in fact if you reduce your calcium intake too much, that can paradoxically increase your risk. So the message from me is relatively clear that it is, as we don't really understand how stones form, the common sense approach is to increase your fluid intake such that your urine is nice and dilute, and that whatever's in your urine that predisposes you to stones is reduced and more dilute. Reduce the chemical constituents in the urine so they're not there in an excess, so reduce your oxalate containing foods. Modify the calcium in your urine by reducing your salt intake, and that should protect the majority of patients.